Welcome back to another explainer. If you are right in the thick of the chaotic, totally beautiful, but let's be honest, sometimes completely overwhelming world of a baby's first year, well, you're in the exact right place. Today, we're tackling something that causes so much unnecessary stress for new parents. Yep, we're talking about developmental milestones. We're going to cut right through all the noise, dive into the data, and use some incredible clinical insights from Dr. Honorata to really empower you. By the time we wrap up this explainer, you're going to know exactly how to track those first-year milestones without all the anxiety. Okay, let's just dive right into our roadmap. First up, we'll tackle the comparison trap. Second, we're looking at gross and fine motor skills. Third, we'll cover connecting through speech and social milestones. Fourth, we'll dig into the hidden factors influencing your baby. And finally, number 5, recognizing the actual red flags. So, kicking things off with part 1, the comparison trap, and why we tend to panic over other people's kids. Let me ask you this. Have you ever found yourself comparing your baby's progress to a friend's baby, a cousin's, or maybe even an older sibling? I mean, it happens all the time, right? You're at the park, you see a neighbor's 10-month-old practically sprinting around, and suddenly you're in a panic because your 11-month-old is still just, holding onto the couch, trying to stand up. But the source material is super clear on this. Using milestones as a comparison tool, it's basically just a recipe for anxiety. Milestones are tools to help us understand development, not some kind of competitive scoreboard. Moving right along to part 2, motor skills, both gross and fine, essentially moving and grasping. So let's trace the timeline for gross motor skills, the big muscles. We usually start seeing action around 3 to 4 months. This is when your baby starts lifting their head and chest, getting that solid, steady neck control. Then, fast forward a bit to 5 or 6 months, and they start rolling over on their tummy. We're talking front to back to front, the whole shebang. By 7 months, they're usually sitting up with a little bit of support. Then, around the 9 to 10-month mark, they're pulling themselves up to sit or stand, maybe even cruising around the living room furniture. And finally, independent walking. That usually kicks in between 9 to 12 months. Now, what I found absolutely fascinating in the source material is the sheer, perfectly healthy range we see with walking. I mean, so many parents are convinced their baby has to walk by 10 months, or literally by their first birthday, or else something's wrong. But get this, independent walking can actually happen anywhere between 9 to 18 months of age. Seriously, let that sink in for a second. That is a massive 9-month window, and falling anywhere inside that window is completely 100% normal. Okay, shifting gears to fine motor milestones. These are the smaller, much more precise movements. And honestly, the progression here is just amazing. Between 1 and 3 months, if you touch a baby's hand, they'll give your finger a really brief grasp. By 5 to 6 months, they totally level up. They can actually transfer an object from one hand to the other. Between 7 and 9 months, they start doing this raking up motion, kind of sweeping objects into their little hands. And then by 11 to 12 months, their dexterity is so incredibly tuned, they can actually turn the pages of a book. But without a doubt, the real star of the fine motor show is the pincer grasp. This is that super mature ability to pick up and hold an object securely using just the thumb and forefinger. This absolute magic milestone develops right around 10 months. And it's a huge deal, folks. This specific little grip is what finally allows babies to effectively stack their toys and, perhaps more importantly, pick up tiny pieces of food so they can make a spectacularly huge mess all over your kitchen floor. All right, moving into part 3, connecting. This is all about speech and social milestones, basically communicating and feeling. The speech timeline starts out so sweet and simple. Around 3 months, you get those incredibly adorable cooing sounds. By 4 months, they might actually bless you with a laugh out loud, a real ha-ha. At 6 months, that turns into some pretty complex babbling. Then, between 7 and 8 months, they start responding when you call their name. They might even say up when they want you to carry them. And then the absolute magic happens right around 9 or 10 months. Those first deliberate mama and dadas. By their first birthday, they might have anywhere from 1 to 3 words in their vocabulary, though remember, this varies wildly from child to child. Now, running right alongside speech is the social timeline. It all kicks off early on with a responsive smile. By 4 to 6 months, your baby is keenly attuned to you. I mean, they actually respond to your emotions, and they might even cry if you abruptly stop playing with them. Fast forward to 9 and 10 months, and boom, stranger anxiety hits its absolute peak. And by 11 to 12 months, oh boy, they start developing some very strong opinions. You'll often see clear food preferences emerge when they dramatically push their plate away just because they aren't interested. I really want to highlight that very first social milestone we just talked about, the social smile.
Developing somewhere between 1 and 3 months, this is, well, it's not just a reflex from gas, okay? It's a genuine, responsive smile. It's literally their very first purposeful form of social connection with you. And it's a massive, beautiful indicator that their little social awareness system is properly booting up.
And, this brilliantly brings us to the other side of that social coin, object permanence. This is the understanding that things still exist even when you can't see them. The thing is, babies aren't born knowing this. So when that stranger anxiety peaks around 9 to 10 months, it's directly tied to this very concept. The source material notes that parents will sometimes say they can't even run to the washroom without their baby crying desperately. And that's because to your baby, once you leave the room, you have literally ceased to exist. Kind of mind-blowing when you think about it from their perspective. Which brings us to part 4, factors influencing your baby. These are the invisible drivers of development. So, the absolutely crucial point here is that child development isn't just some standard biological clock ticking at the exact same speed for every single kid. A baby's timeline is governed by so many things: their genetics, the stimulation they get in their home environment, their unique temperament and personality, and even specific cultural practices in how they're raised. But there is one specific factor on this list that requires a very real mathematical adjustment from parents, and that factor is prematurity.
See, if a baby is born prematurely, parents often start panicking when their little one doesn't hit milestones at the same chronological age as full-term babies. But we really have to look at what's called adjusted age. This means calculating their developmental expectations based on their original due date rather than the day they were actually born. You have to give them that extra time they need, time they would have had in the womb to reach those milestones based on their true physical maturity.
All right, let's head into our final section, part 5, recognizing red flags and when you should actually seek help. While we've established that development is highly unique, medical professionals do use some definitive cutoff points. For example, if your baby is 6 to 7 months old and has absolutely no responsive smile, or if they're 6 to 7 months old and still have no neck control, those are real clinical red flags. The source is super explicit here, warning parents, do not just brush this off. And please, do not listen to those well-meaning relatives who say things like, "Oh, don't worry about it. In our family, your uncle only spoke when he was 6 years old."
Seriously, if you spot one of these actual red flags, you need to go get an assessment from a doctor as soon as possible. Why? Because early intervention is the absolute key. If a child is at risk for a developmental delay, getting them professional help early on greatly, and I mean greatly, increases the likelihood that they can actively catch up. They can attain those milestones at a much faster pace. Wait and see is simply not the winning strategy here.
To wrap up everything we've covered today, I want to leave you with this core quote right from the source material. It says, "Developmental timing is a range and not specified by the age." That right there, that is the ultimate takeaway. Because milestones are driven by multiple, totally unique factors. From genetics to environment, your child's timeline is a deeply individual range, not some rigid deadline you have to stress over. Which leaves us with one final pretty important question. How can you actively support your baby's unique developmental journey today, instead of just sitting there watching the clock? My advice? Use this explainer to look for the right things. Keep an eye out for those social smiles, the pincer grasps, the object permanence, and celebrate them when they happen on your child's schedule, not the neighbor's. Thanks so much for learning with us today, and we'll catch you on the next explainer.